Hi, my name is Thomas Kearl. In December of 2020, I was very healthy, so we decided to get an Airbnb in Arizona. And then on New Year's Day, my daughter told me that her friend had been exposed to COVID and she had a sore throat. We were going home the next day, January 2nd, and I didn't feel well that morning. 10 of us were positive with COVID. So a few days later, I went to the hospital because I had a high fever. They gave me an IV, but they did not test me for COVID. 4 days later, I was so sick, I could not get out of bed. I could not lift my head. I went back to the hospital and I had COVID. I was then put on, 2 days after that, on a ventilator. I have a tracheostomy scar here. I ended up spending 223 days in an ICU bed because of COVID. Everything you've ever heard about COVID happened to me. I was having a CT scan. I ended up dying in this CT donut or tube. I then ended up spending the 223 days in ICU, and I ended up dying 5 times. I suffered greatly. I could not walk, I could not stand. Took me 4.5 months of rehab to stand on my feet again. I had a torn rotator cuff from a transfer injury in the ICU. I had no feeling in my legs. I had so many problems, it was unbelievable. But still, I continued to fight. And when I went home, I made a big mistake. I thought that everything would be normal. I didn't understand that my life was changed forever. And my lung function was so destroyed by COVID that I suffered. I need constant oxygen just to sit in a chair. In January, I started coughing while eating blueberries, and I aspirated and swallowed some of the blueberry into my lung. And 10 days later, I had an aspiration pneumonia. I continued to get worse. I was on the lung transplant list, and they had to take me off the list in April because they did a PFT, which is a pulmonary function test. And they told me that I had terminal pulmonary fibrosis and I was very ill. My doctor in the consultation the next day told me that they're very concerned it's progressing faster than they thought. She told me there's really nothing we can do for you, Tom. If I had to guess, you probably won't be here by September. She covered her hospital name tag and she said, Tom, you need to go to Mexico and get stem cells. I started to do some research, and through one of my doctor's patients, I heard about the Bioadvanced Medical Center in Tijuana, Mexico. So I called and I spoke to a woman named Betty, and she was wonderful in helping me try to get in to see the doctor. I met with Dr. Benjamin and Dr. Antonio Calzada, and they came up with a plan for my treatment. And he told me, Tom, I'm sure we can help you. He said, I cannot remove the scar tissue, but I can make the rest of your lungs more healthy, and then you can function. So I came every 2 weeks from California into Mexico for 2, 3, 4-day sessions, having mesenchymal stem cells. And one of the miracles that have happened to me is I needed rotator cuff surgery to fix my arm. I could not lift my hand beyond this. He gave me 2 shots on that first visit, and I can now. When I returned to Utah in August, they did a CAT scan to measure the growth of my fibrosis, and my fibrosis that they could not remove, but they were hoping to stop it and arrest it, has not grown since May. And my doctors in the U.S. were absolutely astounded that this is miraculous. And I was encouraged, keep getting the stem cell therapies. I feel very strongly that Bioadvanced Medical Clinic in Tijuana, Mexico was part of my path to get it so I could fulfill what I'm supposed to do. And that is show that if you trust God, you can overcome any hardship. The doctors have become my amigos. I feel like this is family now. That's how good this place is. I appreciate everything you have done for me. I appreciate your kind, gentle ways. I appreciate your approach to not wanting to poke me with a needle to make money, but you're wanting to poke me with a needle to make me healed, rather than give me a drug to treat a symptom. I appreciate it.